So, hey everybody, hi everybody again. I would like to welcome you to today's online webinar on hormonal health. I'm very pleased that there are so much interest in the topic, and there are around 120 people registered. For now, I would like to ask you to fill out the registration form in the link in the chat. Sorry, and if you have not yet filled it out, with this we will receive email addresses from you to which we will be able to send certificates of participation. I will also ask you to confirm in the chat if everything is fine, if you can hear and see me. So please write in the chat yes or no. Perfect. So allow me to introduce myself at the beginning. My name is Natalia, and I hold the position of Regional Project Officer at IPSF EuRO, and this is our second online project. IPSF is the leading international advocacy organization for pharmacy and pharmaceutical science students and recent graduates, promoting improved public health through the provision of information, education, networking, and a range of publication and professional initiatives. I think there is one problem that ABA Kirk cannot hear. Daniel, can you help me, please? Is everything okay? Can you hear me and see me?
Yes, we can hear
everything
you.
is okay, Natalia. Sorry.
Okay. Thank you so much. So agenda for today's hormonal health webinar is following. The first part is opening and introduction. The second part is presentation on hormonal health. The third part is Kahoot quiz, discussion and Q&A from the audience. And the last part is feedback form, thanks and closure. In this time, allow me to introduce our speaker, who is Priyanka Patel. Mrs. Priyanka Patel is an advanced medical health clinical pharmacist and teacher with a special interest in ADHD and neurodiversity. She has experience in community, hospital, private, and other varied roles. She had been featured on various healthcare podcasts, ATV2, Sky News, and BBC. She currently works for Mental Health Services while pursuing research exploring issues around gender differences within ADHD medication and treatment. So Priyanka, welcome again, and stage is yours.
Thank you. Thank you so much for your introduction. I'm just going to share my screen now. So hopefully everyone is able to see the presentation. Just give me one sec. Okay. Is everyone able to see that?
Yeah, perfect. It's working.
All right, fabulous. So I'm just gonna get started. So this presentation is going to be talking about ADHD specifically with women. about the hormones and the hidden healthcare crisis. So let's move on to the content. So what we're going to cover is going to be about the gender differences in response to ADHD symptoms. We're going to review the current UK guidance. We'll briefly touch upon the brain regions associated with ADHD and genetic polymorphisms, and then we'll go on to hormonal fluctuations, and then more specifically the response with ADHD medication in terms of gender differences, and then as pharmacists what we can do to better help our patient. So what is ADHD? So ADHD is a neurodevelopmental disorder. It's not a mental health condition. So some people get a bit mixed up and think that it's a mental health condition, but it's actually a dysregulation of neurotransmitters, and there's differences in the way the brain develops and in the way that certain regions of the brain works. So a person who has ADHD, they're born with it. It's a genetic disorder, so you can't acquire it, you can't develop it. And there are 3 subtypes. So we've got the impulsive/hyperactive, which is probably the one most people are familiar with. Then we have inattentive/distractible, and then we have the combined. So what we're going to do first is we're going to build an ADHDer. And this is going to be in accordance of what most people think ADHD is. So we have a small child, someone who is a boy. They're running around, they have poor grades, they can be quite loud and impulsive, they won't listen. I just want everyone to imagine what they think a typical person with ADHD looks like, and just think about the picture you have in your head. Do you think this is quite similar to what you're imagining in your head? If everyone can just react or put in the chat. I'm not sure if you can react on Zoom like you can on MS Teams, but it would be great to just have everyone let me know in the comments if this is the image that they tend to have when they think of ADHD. So we've got a few yeses. Okay, brilliant. So yes, my little test worked well. I don't know if anyone watches Desperate Housewives, but this is Lynette Scarvo's twins, and they were diagnosed with ADHD, and they fit the typical category of what most people think ADHD is. However, ADHD can actually show in another way. So you can find ADHD in adults, it's not just children. They can also be girls, and they can be intelligent. Most people think ADHD is directly related to the intelligence of a person, but in fact, some people with ADHD are very intelligent, and a lot of entrepreneurs and very successful billionaires have ADHD. They can make careless mistakes in their day-to-day life. They can be quite forgetful. They can daydream and struggle with friendships as well. And they can also be quite sensitive and be known as very dramatic. So what can this look like? So yes, surprise for those who don't know, I have ADHD myself, and I think that is why I'm very passionate about trying to raise awareness of this condition and show people that ADHD is not just the typical naughty boys disorder. So here are some statistics about ADHD in women. About 1 in 4 have attempted suicide. Boys are twice as more likely to be diagnosed than girls, and about 50 to 75% of women with ADHD go undiagnosed. And girls with ADHD have a 10 to 12-fold risk of being obese, and girls with ADHD are 5.6 times more likely to have bulimia nervosa, which is a type of eating disorder. So I'll quickly talk about the reasons why this occurs. So first of all, we have differential symptoms. So when girls are diagnosed with ADHD, they tend to be distributing the predominantly inattentive type of ADHD compared to boys, and the inattentive subtype of ADHD most people don't realize is ADHD. So they don't tend to display the stereotypical disruptive behaviors, and these symptoms are often misinterpreted, and women tend to feel compelled to mask to meet the societal expectations and fit into what they have to be as a woman. They tend to internalize their symptoms and also experience more hypersensitivity type symptoms. And studies have actually found gender bias across the DSM-5. So for those who aren't familiar, the DSM-5 is the big handbook of psychiatric conditions, which most psychiatrists will use to diagnose all sorts of disorders. And the DSM-5 is what lists all the symptoms that a person needs to be diagnosed with ADHD. Then we have misdiagnosis. So doctors are more likely to diagnose the presenting symptoms, and therefore women would more likely to be treated for anxiety and mood disorders initially. They're more commonly diagnosed with depression before ADHD, and about 3 times more women are actually given antidepressants before being treated for ADHD compared to boys. And by adulthood, women tend to have at least one comorbid disorder. Then we have the issue of stigma. So women tend to feel like a failure if they can't keep their house in order. There's a tremendous toll of having to keep up appearances, struggling, having embarrassing moments. There's a lot of pressure for women to be a certain way. And when you have ADHD, you go against everything that is. So they're expected to be organized, you know, to be able to have food on the table, pick their kids up from school. And because they go against what society deems as, you know, the norms of feminine behavior, women with ADHD tend to be at risk of harsh social judgment. The executive dysfunctioning, you know, to do day-to-day tasks can be a significant challenge as well. And again, this is another reason as to why women internalize their symptoms and therefore more likely to have poor self-esteem and less likely to feel supported or listened to. Then we've got the lack of awareness and education. So GPs have actually admitted they need more training on ADHD. So general practitioners, these are the doctors that you see in primary care for your minor ailments. And this is because some doctors still struggle to understand the significance of the female anatomy. And some GPs have actually admitted that they do want to have, I've already just said that they want more training on ADHD, Women tend to be perceived as emotional, irrational, hormonal when they go to the GP for help, anything to do with their mental health or ADHD. And they don't tend to be taken seriously. So women and girl symptoms are more likely to be overlooked, and they're less likely to be referred. Women weren't actually included in clinical trials until the 1990s. So we still see a lot of misconceptions about how ADHD presents in girls, and this continues to be a significant barrier for them accessing diagnostic services and appropriate care. And there is also a lot of evidence now which is showing that female hormones do impact ADHD. So now let's have a look at the current ADHD guidance. So what I'm going to be referring to is the UK guidance at the moment, but I think a lot of this could be extended towards European guidance, as I think there is a lot of overlap and similarities. So let's look at historical bias. So I've already mentioned that women weren't included in clinical trials until the 1990s. And the guidance which is built in the UK is called NICE guidance. And this is what a lot of the clinicians refer to in, you know, as what are symptoms of a certain disorder, what are the right medicines to prescribe for a certain disorder. But when I looked at this guidance, a lot of the papers were actually based on studies done on boys. They focus primarily on hyperactive young boys. So therefore, the criteria of our ADHD typically... Oh my gosh, I'm so sorry. My ring light just fell. Give me one moment. Oh. I'm so sorry. Hopefully that will stay stable. If not, then I might just have to leave it. So where were we? Historical bias. So because a lot of this research tends to focus on hyperactive young boys, the criteria is more reflective of how ADHD presents specifically in this demographic. And therefore, we have a lot of under-recognition of ADHD in populations that don't fit this criteria. So this isn't to say that men can't display symptoms that aren't recognized. This is to demonstrate that it's inattentive symptoms as a whole that don't fit the criteria. And this is seen a lot more in women and young girls. Then we've got comorbid conditions. So the way that our current guidance is, it doesn't actually allow for a diagnosis of ADHD if you have other mental health conditions. They want to actually rule them out before diagnosing a person with ADHD. but girls are more likely to have internalizing symptoms, and they're more likely to have comorbid disorders such as anxiety and depression. And some ADHD assessment tools might not even capture these comorbid conditions effectively. So another reason as to why there's a lot of under-recognition in ADHD in girls, and also misdiagnosis. Females with ADHD were actually 5 times more likely to have a lifetime diagnosis of major depression, and that makes it even harder for them to seek a diagnosis later on in life. It was only in 1991 where the MHRA, which is the Medicines and Healthcare Products Regulatory Agency, so this is the department that are kind of the big bosses when it comes to everything to do with medicines in the UK. And they highlighted the importance of including women in clinical trials. And that was only in 1991. And the first conference on gender differences was only done in 1994. So the rising awareness of ADHD in women was only seen in the late 20th and early 21st century. And this is when we've now started to see a bit more of an improvement in gender when it comes to ADHD. So now we're going to have a look at the predominance of the hyperactive impulsive symptoms. So this ties in hand with the historical bias. So as I've mentioned before, the DSM-5 tends to focus a lot more on the hyperactive impulsive symptoms because a lot of the studies have been done on little boys. And whilst the DSM allows the diagnosis to be made primarily on inattentive symptoms, there is still a big focus and prominence on ADHD being a hyperactive disorder, which leads to clinicians still stereotyping it as a hyperactive disorder. Then we have the sub-threshold diagnosis. So when we look at the DSM-5, it requires a certain number of symptoms to be present for a diagnosis. So you have to have at least 6 symptoms. And some say that this threshold might actually miss individuals, especially girls and women, who do have significant impairment but might not meet the exact symptom count. I don't expect everyone to read all of this, but this is just an extract of some of the studies which were included in the guidance on ADHD. And you can see in some of the words that I've bolded, you can see so many studies have been done on boys, yet women are expected to adhere to this guidance despite a lot of these studies not even being done on their gender. So now we're going to move on to hormones. So this right here, I made earlier, it's a diagram of the female menstrual cycle. So as you can see, there is a lot going on. We've got 4 different hormones that work in a monthly cycle, and they fluctuate quite a lot. This nice little line up here is the male hormone cycle. I like to describe the difference as the male hormone cycle being, like a calm river rapids, and then the female hormone cycle being like a roller coaster. So when we think about medication, if you give a medicine to a man and a woman on day 7, and then day 14, and then day 21, you can see right here that on each day, not only is a woman going to display different symptoms, because we know hormones impact absolutely everything in our body, but on top of that, they're going to also respond differently to medicines. But when we look at the male hormone cycle, they're going to respond more or less the same. So why has this not been taken into consideration? This here is an extract from the British National Formulary. I like to describe this as the Bible for pharmacists, because this is the manual of everything to do with medication, from the dose to the indication to monitoring, everything. So this is the recommendations for ADHD medication. So Delmosar, it's a brand of methylphenidate, which is a stimulant licensed for ADHD in the UK. And as you can see here, the dose for a child and for an adult are the same. And when we look at Elvance as well, it's the same. So based on our guidance, a child and a 55-year-old woman would be given the same medication at the same dose for ADHD. And I personally think that this is quite alarming. So now let's look into some of the female hormones in a little bit more detail. So estrogen, there are actually 3 different types of estrogen. But when we refer to estrogen, we are actually referring to estradiol, which is E2. And this is the main form of estrogen, which both genders actually produce, but it's primarily, obviously, in women. And this is the one that is most prominent in the female body and what's normally used in hormonal replacement therapy, and it has a very important role in the menstrual cycle and pregnancy as well. So estrogen is a really, really important hormone for women. So when it comes to the brain, it has neuroprotective effects. So it actually helps defend neurons from being overstimulated. It has a role in glucose metabolism, so it helps fuel neurons too. So it has a link to glucose and insulin as well. Then it has an anti-inflammatory effect as well. So it helps produce something called BDNF, and it does this by inducing the BDNF gene. And this is essential for neuron health and synaptic function as well. And estrogen also regulates the production of inflammatory molecules. The disruption of the relationship between estrogen and BDNF has been found to actually contribute to neurological and psychiatric conditions, including ADHD. Then we have neurotransmitters. So estrogen has been found to be significantly involved with dopaminergic, serotonergic, and glutaminergic systems. And some studies have theorized that it has properties similar to those of atypical antipsychotic medications, which is really interesting. And then I don't know if anyone's heard of BPA. So these are environmental estrogens, and they mimic estrogen in the body. And these can be taken in through water bottles, through environments, through certain chemicals found in even moisturizers, shampoos, and high levels of these have been found to influence ADHD. So based on that, it shows that there is a very strong link between estrogen, the brain, and therefore ADHD. So when we look at the three neurotransmitters in a bit more detail, the main thing that I want everyone to take from this is that estrogen is very important for all three of these: dopamine, serotonin, and noradrenaline. These three neurotransmitters have been found to be very heavily influenced in ADHD, particularly dopamine. And what estrogen can do is it helps widen essentially the receptor of dopamine 2. And this is a dopamine 2 receptor is very important in neuronal transmission in the brain. And estrogen can actually reverse the function of dopamine reuptake. So it stops the dopamine being taken back up into the presynaptic neuron and lets the dopamine stay in the synaptic cleft a bit longer and have more of an action. Estrogen does this with also serotonin and noradrenaline as well. And what estrogen also does is upregulates tyrosine hydrolase. This is the enzyme which is involved in the synthesis of dopamine and serotonin. So by upregulating it, it helps increase the production of this. So as you can see, there is a lot involved with estrogen and these neurotransmitters. And studies have found that that E2, so when I talk about estrogen, remember we're referring to E2, it can act directly on an area of the brain called the striatum to stimulate dopamine synthesis. And the striatum is an area of the brain that's been heavily influenced in ADHD as well. So there are three main receptors involved in estrogen. So we have ER1. Is everyone familiar with what a genetic polymorphism is? I just want to double check first before I continue, because I want to make sure that everyone can follow along and I'm not confusing people. So just let me know in the chat if you're familiar with genetic polymorphisms. Yes? Ah, amazing. Oh, we've got a bunch of clever lot here, haven't we? So there was a very recent study that was actually done in 2023, so this year, and they found that there was a certain genetic polymorphism, this is the big long name of it, with estrogen receptor 1, and this was actually associated with ADHD. And estrogen receptor 2 polymorphisms was also found associated with ADHD. There was one study which was actually quite interesting, and what they did was they took out this receptor in a mouse, and they found that that mouse had less dopamine turnover and lower levels of the dopamine transporter as well, which again just really shows how much estrogen influences not just the neurotransmitters itself, but also these receptors as well. And then G-coupled protein receptor 30 is another receptor which is involved in estrogen. Even though it's not a specific estrogen receptor, it does, these are the three main ones. And there have been studies that have found decreased activity of this in ADHD. Whilst these studies weren't directly looking at estrogen, this receptor does work with estrogen. So again, it's even more evidence to show the importance of estrogen in ADHD. I mentioned before the importance of BDNF. And what happens is estrogen binds to estrogen receptors, and this is what helps create BDNF. And it's influenced by estrogen signaling pathways, and there have been polymorphisms in the BDNF gene which have been linked to ADHD as well. So here we've got a diagram of the brain mechanisms and regions affected in ADHD. So I know this is a lot to take in, so do not worry about trying to memorize this all, and don't worry, I'm not going to go too much into this. But some of the things I want to highlight is, can you see the cursor here? Does the blue cursor come up when I'm moving? Oh, fabulous.
Yeah.
So here we've got the amygdala, which is an area in the brain that's really important for emotional processing. And imaging structures have found difference in the sizes of the amygdala in genders as well. And then there was also certain striatum pathways. I'm trying to find okay, here we've got the nigrostriatal pathway here as well. So there are certain pathways which are also different in men and women. And the important thing is that when we look at the gender differences in brain regions, the differences are found in brain regions that have been linked to ADHD. So it's evident that there are gender differences in ADHD when we look at the brain itself. So just mimicking what I said, there are sex differences reported in regards to dopaminergic tone. So the responsiveness of the dopamine system, it differs in females compared to males as well. So the dopamine transporter, which actually regulates the availability of dopamine, is actually more readily available in women compared to men. So women have a higher turnover of dopamine compared to men, and this has been linked to be estrogen dominant as well. That's what I've just said. Sorry, I think I didn't move the slide fast enough. When we look back at those brain regions that I just showed you, that picture, there are a lot of estrogen receptors which are found all over the body. But the ones that are found in the brain, these particular regions in which they found to have been linked to ADHD as well. And yeah, sorry, I've just said everything which was on this slide. Sorry, I think I've practiced this presentation so many times that I'm getting ahead of myself now. So as we can see from those images and the information on this slide, there are gender differences in the brain and therefore in ADHD brain regions. So just going back to the genetic polymorphisms, these are the ones which have been found that have been linked to ADHD. And there have been some studies which have found gender differences in some of these genetic polymorphisms as well. So when we look at COMT, this is what breaks down dopamine. And estradiol's dopamine agonistic-like effect actually depends on this enzyme. So therefore, this genetic polymorphism is going to affect women differently and men differently, even if they both have ADHD as well. And there was one really interesting study that looked at dopamine receptor 4, and it found that there were gender differences in cognitive empathy as well. So might explain women, if you have a boyfriend that's just not being very emotional when you've had a bad day, it's their genes and it's the way that their brains are made. So you know how they say women are from, men are from Mars, women are from Venus? It's true. We have different brains, and the science shows us that. So here is the hypothalamus pituitary axis. So I assume a lot of you are very familiar with this. This hypothalamus it's found in the brain, and this is the big boss of everything to do in our body. And what happens is the hypothalamus will send signals to the pituitary gland, and this will then send signals to different types of pathways. And the disturbance in the HPA can actually has actually been linked to ADHD as well. And it's very difficult to try and explain, because the neurotransmitters we've looked at, dopamine and serotonin, they influence, prolactin, they influence gonadotropin hormone, they influence FSH and TSH, all of that. But then all of these hormones then influence dopamine itself. So it's a cycle, and it's a feedback loop. So when you have a condition like ADHD, all of these pathways are affected, and that explains why a lot of people that have ADHD end up having thyroid issues, or they have menstrual disturbance issues, and they also can have adrenal fatigue as well. But the one thing which is really important is that the hypothalamus controls the menstrual cycle. So as we can see here from the diagram, the hypothalamus, the pituitary, GnRH, FSH, LH, and that influences the gonads. And this is a very important study, and it found that in every episode of hormonal changes, women with ADHD suffered 2 to 3-fold increase in frequency and severity of mood changes. So this itself just shows how much hormones actually influence ADHD. So we're going to have a look at each stage of the menstrual cycle, and I thought I had a slide. Oh, here we go. Sorry, I got ahead of myself again. So we're going to look at the different stages of the menstrual cycle now. So we've got menstruation, and then this is part of the follicular phase till day 14. And then we've got ovulation, which actually happens just before day 14. And then we go to the luteal phase. So in every woman, the luteal phase is the same length of time. It's the follicular phase that differs, but just for simplicity, we're going to do this in accordance to a regular 28-day menstrual cycle. So in day 1 to 5, that's when a woman is going to menstruate. And here we have a decline in all of our hormones. So estrogen and progesterone are at their lowest. And some women have reported an increase in their ADHD symptoms at this time. And another thing to take into account is opioids such as cocodamol, which are used for pain relief, can actually mask the CNS effects of stimulants. So sometimes some women might not realize that they're on a dose that might be too high if they're taking medication like cocodamol, because they're masking the effects of increased heart rate and palpitations and things like that. And there's also an increased severity of emotional dysregulation as well. So menstruation, women's ADHD symptoms are very, very poorly controlled. Then we move on to follicular phase. So after around day 7, approximately, we start to see a rise in estrogen. So here, the bright pink, that's the estrogen here. And as we've already seen, estrogen is really important for not just producing the neurotransmitters we need in ADHD, but also helping to transport them around the brain and influence the pathways and the density of receptors. So here we're seeing an improvement in ADHD symptoms, but we're still seeing a low amount of progesterone. And studies have found that women are actually a lot more sensitive to ADHD medication. And this makes sense because you have a lot more estrogen, you've got more of dopamine being produced, and therefore more of that being left in the synaptic cleft. So you're going to have more of an effective medication. Then we've got ovulation. So ovulation is the peak of estrogen, and around here is when a woman will probably feel her best. The worst thing is ovulation is only about 6 days. So I think women get only about 6 days of feeling their uttermost best every single month, which is very sad when you think about it. So this is where we're going to have a peak and in the production of all the neurotransmitters. But then straight after, we have such a steep fall in estrogen that it can actually be such a shock to some women, feeling so good one day and then all of a sudden just feeling awful. And whilst we're having that decrease of estrogen here, we then start to see progesterone rising. Progesterone is known as the pregnancy hormone. And what happens in every menstrual cycle is the reason progesterone is there is to prepare us just in case we've got an egg that's fertilized. So for basically half of our menstruating lives, our bodies are just preparing for a child, which is really frustrating. So progesterone is why we feel really tired all the time, why we want to eat more. Progesterone slows our gastric tract down so it can absorb the nutrients for a potential baby. But this is why women tend to feel very sluggish in the luteal phase. And the luteal phase is where we're leading up to now, is where ADHD symptoms can be the most problematic. And that's because we've got the highest amount of progesterone and we've got the lowering of estrogen as well. Studies have found that when there is low estrogen and high progesterone, that's the hardest part of the cycle to be in for women. Women were found to be a lot more impulsive during the late follicular phase as well. And so this is the part of the cycle where we really need to help women with ADHD because of the hormonal fluctuations that are here. And progesterone can actually have an inhibitory effect on dopamine. So it's working against what estrogen's doing. So with that going down and this high, you know, it's just the worst time for women with ADHD. Let's just say that. So looking at estrogen and progesterone specifically, sorry, I've just lost my slide. So right here, this is ovulation, the peak. And so this is where we have the increased activity of neurotransmitters. And when it's low, that's when we have the reduced executive function. So the main estrogen receptor is actually abundant in the amygdala. And as I mentioned before, this is the brain region that's involved in emotional regulation. So that's where we can see, for example, what women are, you know, PMS and being moody and irritable. It's because of the low estrogen that's making it difficult for us to process emotions. This is something that's already a struggle for women with ADHD. So they can really, really struggle with the low amounts of estrogen here. And studies have found that estradiol, as it releases the dopamine in the striatum, which is again an area which is really important in ADHD, it's, you know, we want to see that increase. And this is why this part of the cycle is the only part of the cycle where, when you have ADHD, this is where you feel the most control of your symptoms. And then when we put progesterone into this as well, the reduced executive functioning is when we have the peak. So there is a negative correlation with progesterone and ADHD symptoms and a positive correlation. So how are drugs influenced? Because as we can see, you know, from what I said before, women are more sensitive when there's a high amount of estrogen. Therefore, the doses which might be okay with the lower amount of estrogen might be too high here. And this again refers back to the first diagram I showed you of the male hormone cycle compared to the female. You know, women are going to respond differently. They might not even respond that well to medication at this phase, but then they might be too sensitive to medication here. So the dose of the medication might be too high here, and the dose might be too low here. So this is something which I think needs to start being looked at when we look at ADHD guidance, is that we need to start, I don't know why there's a line on the page, I don't know how I drew that, sorry. We need to start tailoring doses in accordance to the menstrual cycle fluctuations, because the sensitivity towards medication is going to differ. So let's have a look at the two main medicines used for ADHD in response to hormones. So methylphenidate, it's a reuptake inhibitor. So what it does is it binds to the presynaptic neuron here. So this is methylphenidate, and it binds to the dopamine reuptake transporter. So what this DAT usually does is it will let the dopamine out here, but then it will tell it to come back in, and then it's stored in this vesicle. And what methylphenidate does is it blocks this. So it prevents DAT from taking the dopamine back up into the presynaptic neuron, and it lets it stay in the synaptic cleft a little bit longer. The efficacy of this medication has predominantly been studied in males, and there have only been a few studies done on females, and they actually found them a lot more sensitive to methylphenidate, which makes sense when we look back to the brain pathways. And remember, I mentioned that women tend to have more active dopamine receptors, and they tend to have higher dopamine turnover. So that's why they are a lot more sensitive to methylphenidate as well. And despite being on the same dose, high concentrations of this medication were found in female brains compared to males. Again, sorry, getting ahead of myself. So there's a high concentration of dopamine transporters. So of course, there's going to be a higher turnover and increased sensitivity to them. And this is all estrogen dependent, as I keep harping on as well. And because of the fluctuations in estrogen, that's going to alter the activity of dopamine in the striatum, and therefore the response to methylphenidate. So that's the take-home message, the main take-home message that I want everyone to to take from this presentation is the impact that estrogen not only has on symptoms, but also response to medication. Then we'll look at lisdexamfetamine. So this is known as Elvance, or in some other countries, this is known as Vyvanse. This is the only medication available because of the patent. I don't know when the patent expires in other countries, but I know in the US it's expired this year. But I think it's still in the UK, still holding on a little longer. So we're not going to see any generic forms of this. And what actually happens is lisdexamfetamine is a prodrug. So when it gets into the body, it's metabolized into dexamphetamine and L-lysine. So it's actually dexamphetamine which is having the action in our body, and not lisdexamfetamine, which some people think. So it works similarly to methylphenidate in that it blocks this reuptake inhibitor DAP. But then what it also does is it's quite smart. It goes into the presynaptic neuron, and then it finds the vesicle that I mentioned before that holds the neurotransmitters. It reverses the action of it. So instead of allowing the vesicles to hold the dopamine, it tells them to expel it. So not only are we having the reuptake being blocked, we're now having anything held in being let out. So we've got two ways in which dopamine is being increased in the synaptic cleft. And one thing which is very interesting is there was a study done in 1999, and it found that the acute effects of amphetamines were actually stronger during the follicular phase compared to the luteal phase. And this makes sense when we see, when you think back to the diagram I showed you, where there's higher amounts of estrogen in the follicular phase. Of course, there's going to be more response to these sort of medications because there's more of these neurotransmitters that can be, the medication can have an action on. Again, the efficacy predominantly has been studied in males. Whilst the effects of amphetamines were more pronounced during the follicular phase, the women had a stronger response to the medicines in the follicular phase. So this is why I said we should look at giving lower doses during the follicular phase when the estrogen is high, because women are going to respond a lot more stronger to amphetamines during this phase of the cycle. Again, there's loads of studies done on rats. They don't have the menstrual cycle in rats is obviously not exactly the same as humans, but I think the fluctuation and estrogen is quite similar, because the estrogen will rise to ovulation and then go down. So I think that's why some of this evidence can be taken and extended towards humans. So what they did in some of these rats was influence the estrogen levels and then gave them amphetamines. I mean, I want to know who thought of doing a study like this, giving amphetamines to rats. It sounds like an interesting study. But they found that by giving estrogen to some of these rats, it actually increased the effect of amphetamines. So we've got tons of evidence showing the influence that estrogen has, not just on ADHD symptoms and brain cognition, but also increasing the efficacy of amphetamines and drugs used for ADHD. And this is done through the amphetamine-induced dopamine release. So if you remember the diagram I showed you previously of the mechanism of action, this is all influenced by estrogen, because I mentioned before that estrogen influences the dopamine reuptake transporter. So therefore, by default, if it's influencing that transporter, it's also going to influence the way that the medication responds to it. We'll just touch upon the non-stimulants just a little bit. So atomoxetine is a non-stimulant that's licensed in the UK, and this influences noradrenaline and dopamine. There's been better impulse control seen in males compared to females. However, the studies have found that this has actually been greater treatment for emotional dysregulation in women, and women actually reported lower percentage of side effects compared to men as well. So potentially something like atomoxetine might be better for women, but we need to see more trials done in this so we can actually find what's the best treatment for women. So the main things from this is, we want to tailor doses. we want to give a lower dose when estrogen is high, i.e. around ovulation, and the follicular phase. And then we want to consider non-stimulants as well, such as atomoxetine, particularly if presenting with predominantly inattentive symptoms. Because as the current guidance is, you know, it's based on the condition rather than the symptoms. And everything has been tailored according to the stereotypical naughty boy. So stimulants work for patients showing those symptoms, but might not work for those showing inattentive symptoms. I didn't touch upon this last point because this is something which I think still needs a bit more research into it. But there was some evidence that suggested that longer acting forms of medication were metabolized faster in women. And I think this goes back to the higher turnover of dopamine in certain areas of the brain. So therefore, we can consider shorter acting formulations instead for women rather than longer acting ones. So that's everything. Thank you for joining me today. And I hope I'm in the time. Oh, I've just seen your message, Daniel. I'm so sorry. Where I'm done now anyway, so we can move on to the Q&A.
Thank you, Priyanka, for a very helpful and interesting presentation that provides us with amazing facts about hormonal health. And at this point, we would move to another part, which is Q&A from the audience. We have some questions. So the first one is ADHD caused by genetic or environmental factors?
It's a combination. The way I like to describe it is, if you have ADHD, it's like you're born in a certain type of car. So let's say everyone is driving around in automatic cars. When you have ADHD, you get given a manual car by default, and everyone's driving around in automatic cars. And then what happens is your car's obviously, you know, got a lot more problems. It goes a bit slower because it's a bit of an older version, let's say. And I like to describe environmental factors as petrol as such. So depending on how much petrol you put in your car is dependent on how fast it goes. So the faster the car goes, we can describe it as how severe ADHD is. So, you know, that's when environmental factors come in. So, you know, your diet, potentially smoking as well, pollutants, other BPAs, as I mentioned before, those can also be, like, you know, in this metaphor, the petrol. So the more you're putting in that manual car, the faster it's going. So, you know, people don't acquire ADHD. The reason why some adults get diagnosed later is because those symptoms were being masked. They didn't know. And, you know, a lot of women tend to get diagnosed during menopause because of the decline in estrogen. But also as adults, when, you know, they don't have their mom and dad there telling them, no, you can't have ice cream for breakfast. You need to go to bed now. You've got to do your schoolwork now. You know, when you have ADHD, you don't have that adult voice in your head. It's a disorder of, self-regulation, and you don't have that as an adult. So everything that was put in place that might have been masking and containing the ADHD resurfaces in adulthood. So it is primarily genetic, which a lot of the genetic polymorphism studies have been found, and they've found a lot of links between certain genes, but the presentation of that is influenced by phenotypes and also environment.
Thank you, Priyanka. And before the second question, if anybody has a question for Priyanka, you can write it in the chat. So the second question is, can you be diagnosed with ADHD with the absence of attention deficit symptoms?
I assume that's referring to ADD, which is previously in the classification. So when you get diagnosed with ADHD, it's the way the UK guidance is, it's at least 6 symptoms. And those 6 symptoms doesn't have to be 3 inattentive, 3 hyperactive. It could be 1 inattentive and 5 hyperactive, or it could be 6 hyperactive. So yes, you could be diagnosed with ADHD with the absence of inattentive symptoms. And that goes back to what people thought the stereotype of ADHD was, because that's what people thought it was. But now, as we start to learn a bit more about the condition and what inattentiveness ADHD looks like, you know, combined type encompasses both. I personally have both, but hyperactivity, it displays a lot differently in women. Because we internalize it, we have a lot of anxiety symptoms. You know, hyperactivity can be seen, you know, with racing thoughts, with nail picking, you know, like kind of hair fiddling and not being able to sleep at night, you know. That's how hyperactivity can also be seen, and, you know, not just running around and not being able to sit still, which of course is also ADHD, but the type of hyperactivity can differ.
Perfect. Thank you so much. And we have a question from the audience in the chat. Is there higher predisposition to have neurodegenerative disease like Parkinson when person has ADHD or some hormonal problems?
So it depends on the brain regions which are affected, but I personally think, based on the science and the evidence, any conditions which involve dopamine regulation and dopamine pathways, if you have ADHD, you are going to be at risk of potentially developing some of these types of conditions because they're affected by similar brain regions. You know, that's why, for example, you know, certain medications that are used for psychosis, this is another topic which is really interesting, is what you do with patients that have ADHD and psychosis, because antipsychotics work by lowering dopamine, but ADHD medications work by increasing it. And as we know, I assume, you know, with some of the side effects of antipsychotics, you know, Parkinson's type symptoms are a side effect from that. So it's, you know, it's linked towards the dopamine and those certain areas of the brain. So it's difficult to confirm for 100%, but if, you know, I don't know specifically the brain regions affected in Parkinson's, but if they're similar to ADHD, then I would assume so. I've just seen the other question. When do you discontinue treatment for ADHD if you were diagnosed as a child? So it depends on every patient. ADHD medicines aren't really indicated to be taken lifelong. The role of medication is to be used as a tool. It's to help. Medication helps with being able to be a bit more calmer. You know, there's been some stories of some people actually finding out they have ADHD by, you know, going on a night out with friends and, you know, a lot of them using recreational drugs, such as Adderall, and they're there replying to emails and, you know, just feeling very calm throughout that night. And it's, you know, it's because of, you know, they have the condition, so that the medication just helps calm them. And it's meant to put you in a position where you can start implementing certain lifestyle interventions to help manage your condition. And then it, you know, it depends, up to you then, you know, when you want to stop, if you want to go back on it. But usually with children, I've seen sometimes that they take medication during the school time, and then during the you know, the summer holidays, they stop taking it. It really does depend on you as a person and how problematic your symptoms are.
Perfect. Thank you so much. And I can't see any more questions in chat, so.
Another thing I did want to mention actually is that for women that have ADHD, there is also increased risk and link between certain menstrual conditions that I briefly touched upon before. So things like endometriosis, PCOS, PMDD, ovarian cysts. A lot of women with ADHD that I've spoken to, they have at least one of them. I personally have endometriosis myself. And after looking at this whole presentation, you know, with the influence of hormones and the imbalance of certain transmitters that then impact these hormones, you know, it makes a lot of sense. So I think, you know, if I don't know if anyone watching this has ADHD themselves, but if you are having any hormonal issues, it probably is linked with your ADHD. Same thing with inflammatory issues such as eczema, asthma, IBS, Crohn's. I mean, that's a whole other topic about inflammation and ADHD, but there's a lot of links with physical health.
Thank you, Priyanka. And due to time, is needed to switch in another part of this webinar. So in conclusion, I would like to say again, thank you, Priyanka, for your time and useful information. Thank you for your enthusiasm and amazing energy.
That's okay. Thank you for having me.
And also, I want to thank you all of you joined today, and I firmly believe that this time has enriched you. At the same time, I'm sending you a link to the chat. Please to fill out the feedback form. Any feedback gives us an opportunity to improve, so I will be thankful. Yeah, so the link is in chat. And at this moment, I would also like you to invite to our last project before the holiday. It will be holiday hangout event on 20th of December. It is an informal meeting full of fun and creative moments. So the registration form and email will be sent 10 days before the event. We are already looking forward to seeing you. And Daniel, if you have information about another amazing upcoming event, so stage is yours.
Yeah. So firstly, thank you, Priyanka, and thank you to everyone for joining. I'm Daniel. I'm the IPSF EuRO chairperson. Like Natalia has kindly said, do fill out the feedback form to help us improve our future events. Then you can get a certificate for joining the event. So do fill that out. The link's in the chat. In terms of our upcoming opportunities, like Natalia mentioned, we have our holiday hangout. This is taking place in just over 2 weeks' time. Be a really nice opportunity for us to network and to get to know each other in a more informal setting. As well as the holiday hangout, we also have a lot of calls open to host IPSF events. So IPSF EuRO events include Trainers Development Camp, Leaders in Training, and also our regional assembly. So definitely look out on our social media to get the opportunity to host these events, bring them to your country, and actually try to share the international network amongst pharmacistans in your country. If you ever have any questions, you can always reach out to us. Our emails are on the calls. And also, I think, Natalia, you have the social media links. So we'll just share those in the chat now. So really, really important to stay up to date with IPSF's activities, follow our accounts, share it with your friends, pharmacy students. It's the best way for us to grow as a federation. And we really, really appreciate all of you joining tonight. And I'll hand back over to Natalia once you've managed to share the social media.
I'm just replying to comments, by the way.
Go for it, yeah.
And some, how do I spell advocate? Sorry, I'm having my mind blank. Advocate. I was going to say as well, if I've missed any questions, or if you had any questions that you weren't able to ask, just let Daniel or Natalia know, and I can try and see if I can answer them another time for you.
Perfect. Yeah, and again, massive thank you for presentation. Hopefully everyone's a bit more enlightened now on the topic, ADHD in women, and the hormonal impacts there. So if you do have any further questions, you can always reach out to Natalia or me. For those that are super eager and want to stay on, the meeting will now, we'll now end the webinar, but we do have a Kahoot quiz prepared just as a more informal way to learn more about the topic. But yeah, we will do that, but we'll thank everyone for joining. In terms of our social media, it's IPSF EuRO on Instagram, LinkedIn, Twitter, and Facebook. So do follow us there. and we will start the Kahoot quiz. But for those who need to be somewhere tonight or need to sleep, thank you for joining. And again, thank you to our speaker, Priyanka. We really appreciate you joining.
You're welcome. Thank you for having me.